So good morning. Just wanted to thank you all for the opportunity to speak today. Myself and Carolyn will be talking about pharmacogenomics and resources for implementation. Next slide.
Cool.
Thanks. All right, so pharmacogenomics, or PGX, is a study of how genetic variations affect drug metabolism. And really the purpose of PGX is to increase efficacy and reduce adverse drug reactions in patients. It's a bit of a hot topic in precision medicine at the moment, but PGX has been around and evolving for decades, as seen here. This timeline shows the overlapping development of ASMs and PGX, and I really wanted to highlight this because there's been an increase in discovery of PGX genes associated with ASMs in recent years, and how this trend is likely to continue, especially with the implementation of PGX programs, which have been rolling out across the United States and Europe. Next slide. Okay, so looking specifically at treating patients with epilepsy, there can be variability in treatment response, which lends itself to tailoring medications and dosing to patients. PGX is promising for a number of reasons. Children are more susceptible or can be more susceptible to adverse drug reactions in adults. For many patients, monotherapy is preferred and can be successful, but in cases of drug refractory and combination therapy, PGX can help reduce ADRs. And the results from this testing could be beneficial in informing medications prescribed by other specialists, either in tandem or in the future. PGX can help develop a framework for determining the best therapies to use with specific patients. And lastly, there's a possibility that this can help reduce cost of care for families in the long run. So there are about 35 approved, there are about 35 approved ASMs at the moment. The FDA has dosage and safety recommendations for a handful of these, as seen here, but there's research suggesting that other drugs could be impacted by PGX as well. And I just wanted to briefly highlight this black box warning for valproic acid, specifically for the POLG variants, which is, the warning is included in this box here. But this drug can lead to liver failure and death in patients with these variants, and it's associated with a mitochondrial disorder as well. But just kind of wanted to give an example before we go into some resources for implementing this.
Thank you so much, Maddie. And then we're just going to dive into a few of the resources that are out there for use by both clinicians as well as researchers and advocates. Like Maddie mentioned, there's been a long-term development in this area, but definitely rapid evolution in the past decade or so. So the FDA has really great resources in their drug labeling tables made available through their Division of Translational and Precision Medicine. So they are updating and publishing guidelines on known gene-drug relationships with sufficient evidence for clinical use. So we have this separated here in kind of like the two main tables. So this table on the left is kind of a higher level associations between genes in general and specific drugs, with information on how those drugs are going to be discussed in the labeling sections. And we have some examples to the left here of what that labeling section might include. And then on the right is a table with kind of finer level details. So that's specific genotypes that are known to have reactions or interactions with specific drugs. So just a little more granular on the right, and on the left is higher level. And these are both pretty easily searchable on Google if you just put in FDA PGX tables. And then you can go through there and kind of search around if there's a specific gene or drug or interaction that you're interested in learning more about. And then we also wanted to include some international PGX resources because we know we have lots of folks from all over here today. So we wanted to highlight both PharmGKB and CPIC, which are kind of consortiums of interdisciplinary teams that are reviewing scientific literature as it's being published so that they can keep updated guidelines on known gene-drug relationships. And then they classify it by the level of evidence. So CPIC is great if you're interested in understanding how a drug has been classified and how an available genetic test result might be used to guide therapy or treatment management, where PharmGKB is kind of like all of the resources in one place. So they compile all of those international drug labeling guidelines an annotation. So depending on who your regulatory body is, they might have specific labels provided there. And we wanted to also give everyone just kind of a quick run through and some quick tips for navigating PharmGKB's website if this was something you were interested in kind of poking into more. So you can see that they have this search bar up here, which is great that they have a whole page for antiepileptics, but you could combine terms and get more specific. And then just wanted to show the drug label annotation section that they have. So this is great because you can both search by your regulatory bodies. I'll select FDA because that's the example we've been discussing. And then it'll lay out all the drug and gene published guidelines that are available. And it's pretty great because you can just click right into them and get a pretty high level overview just quickly and simply by looking at labels like these. They also specifically have pediatric labels. So if there are recommendations for pediatric populations, like the valproic acid that Maddie mentioned on a previous slide, and then also kind of condenses down that information that you would find in the drug labels. And in addition, has the formal drug label hyperlinked from the regulatory body. So it's kind of a one-stop shop for all things PGX as they're coming out. And then for the most clinically useful PGX, it might be the regulatory bodies directly that you want to go to just to ensure that everything's up to date. Good. All right, so that was just a quick little overview of all the resources that we like to use. And we also made a quick little resource sheet that is available via QR code here. So if you guys wanted to just scan that and save it for your future use, we have that available. And then a quick thank you to everybody at the KCNT1 Foundation who has helped us and taught us and supported us through this internship. We've really appreciated all of the time and the great people that we've gotten to meet.